Good afternoon, everyone. I want to thank you for joining us. It comes to my attention, I've never really named my podcast channel here, so I'll work on that over the next couple of weeks. But you know what's really important? I just want to get this information out so that we can help save some lives, help change some people's lives, and help you overall just be healthier. I'm Dr. Kurt Schrader. I've been a chiropractor for 25 years, and we've just expanded our practice over those years into holistic healing every aspect. I have a nurse practitioner in my office, an RN. We do a lot of bioidentical hormones, regenerative medicine, and nutritional IVs to help get your body healing the best it possibly can. Now, being a chiropractor for the last 25 years, I've found that correction of the posture is crucial to anything in healthcare. Yeah, what blows me away is how people, they all know the brain controls everything. They all know the brain communicates to the body through the spine. But anytime somebody has a problem, a disease, a sickness, nobody looks to the brain or the spine when that's what controls everything. And it just doesn't make any sense to ignore that. But today we're going to talk about how to boost your immune system. And B.J. Palmer back in the early 1900s said, "One never knows how something we say, think, or do may affect the lives of millions tomorrow." Isn't that the truth? But today we're going to talk about how to boost your immune system by up to 300%. When I'm recording this right now, we're at the beginning of December. We just had Thanksgiving. We just were around a lot of people we're not used to being around, eat a lot of junk that we shouldn't have ate in the first place, overate, and our complete rhythms are off as much as they possibly can be. So what we want to talk about today is, how do we get back on track? How do we boost that immune system, make sure we're not getting sick and we stay healthy? So if you start having symptoms of being sick, right? So now we go to the doctor, and what are they going to do? I don't even care what the symptom is. What's your medical doctor 99% of the time going to do when you come in sick? They're going to put you on an antibiotic, right? Most of us are very aware of that because it's very consistent. It's pretty cookie cutter. The question is, how do they even know it's a bacterial infection? Because unless they culture that, they don't know. If they're doing blood work and culturing, sure, they'll know, but they're not going to know that day probably. It's probably going to be 2-3 days later at least. So when we come down to an antibiotic, this is a huge factor when it comes to our healthcare profession and how we're dealing with illness is an antibiotic. So we need to know how our doctor came to that conclusion, right? Is he just guessing? Did he do blood work? Did he culture it? Did we get back a positive result? Are we even treating the right thing? Because if it's a virus, that antibiotic's not going to do any good, right? Maybe we just ate some crud and we feel like crud because of it. Maybe we got a parasite. Maybe it's an allergy. Maybe it's a toxin. What do we know about this problem? So when we look at the core basis of what an antibiotic is, breaking down the terminology, anti meaning against, and biotics meaning life. So it's absolutely against life. So not only does an antibiotic kill the bad bacteria, if that's what we're dealing with, it's also killing all the good bacteria you have in your body, in your small intestine, your large intestine. It's wiping all that out. That's going to create a cascade of problems moving forward. Don't get me wrong, I'm not saying an antibiotic doesn't have a good benefit. I'm not saying there's not a time that we need it. I am saying it is completely overused and overprescribed when a lot of times we don't even know what the problem is. It's kind of the ready, shoot, aim type of action. Now, with any prescription medication, we also know there are side effects that are associated with that. So if we look at the side effects of amoxicillin, for example, one of the most commonly prescribed antibiotics there is, these are the side effects. We get white patches or sores in our mouth, fever, swollen glands, rashing and itching, pale or yellow skin, yellow eyes. That's a sign your liver or kidneys are failing. Severe tingling, numbness, pain, and muscle weakness, easy to bruise. My favorite, spontaneous Achilles tendon rupture. What do you think's going on in your body when an antibiotic can make the largest tendon in your body explode? I mean, I would love to see the chemistry behind that because that doesn't make sense to me, but that's terrifying. And then the lesser side effects is it can basically cause a yeast infection, stomach pain, or hair growing on your tongue. Disgusting. So what are some other options? What else could we do nutritionally that could help and maybe have less side effects? There's a lot of different options. We have supplementation. Most of these contain echinacea, which is a very powerful one. The Total VRX is designed to really help amp up our immune system to fight off viruses. Congoplex is designed to help amp up our immune system to help fight off that's strep infection for Congoplex. Thymex is actually designed to help boost your immune system to fight off staph infections. I also have a product right here. No, I don't. Okay. I'll grab that and show you that before we end today. But I have it's a liquid Echinacea Golden Seal and Chaparral made by a company called Weed Botanicals. It has nothing to do with weed. It's Dr. Weed's company from out of Canada, and it's called INF Fighter. I don't know if I would know how to practice without it because it's such a potent immune booster, and that's not something, none of these products I'm mentioning are anything that you should take consistently long term. We don't want to constantly upregulate the immune system. That's something we want to do only when we're fighting something off. So we want to make sure that we're boosting the immune system. Better yet, how can we keep our immune system at a higher level so we don't get sick in the first place? So here's that bottle of, it's called Weed Botanical from INF, the company's Weed Botanical. INF Fighter is the name of the product. Very great product. So powerful. I've seen patients heal from MRSA permanently on several occasions with that product. Fantastic product. Going along with that same thought process, if we look at a sinus infection, if you've had a sinus infection that really bugged you and you went to the clinic and basically got treated for that, what are they going to do? They usually give you an antibiotic. Did you know that in 1996, I believe it was, the AMA actually ruled that they should stop giving antibiotics for sinus infections because they just frankly weren't working. So the AMA over 20 years ago says stop using this, almost 30 years ago, says stop using this for a sinus infection. And today you go to the clinic and you have a sinus infection and they still give you an antibiotic. So these same people that say trust the science don't listen to the science. It's the most painstaking thing in healthcare today. Right now in the United States, we rank 52nd in the world in life expectancy, and we spend almost more money than the entire world combined in healthcare. And then people want to fight and say we shouldn't change things. Like, you have absolutely no basis not to change absolutely everything because we couldn't be failing worse. We actually have the shortest lifespan of any first world country in the world and spend more money. It is absolutely embarrassing. Going along with that, look back at 1969. The Surgeon General came out and said that it was a really healthy, great idea to smoke. And then he died of lung cancer. I actually had patients, and I didn't even believe this. I had a patient come in and tell me when he was in grade school, 6th, 7th grade, he actually had asthma. He had asthma, and they prescribed him cigarettes to smoke to help his asthma. Now, you don't need a medical degree to realize that's nuts. That is absolutely crazy. And yet that's what the medical profession taught us back in the 60s and 70s. It's ludicrous. So when we really look at the system, we don't get treated by doctors anymore. We get treated by a system that really has a terrible success rate. Absolutely atrocious. But it makes certain people a ton of money. When we look at the flu shot, this is always a very popular topic. And if you say you don't want the flu shot, you're anti-vax, and they just try and shame you and they embarrass you. And, RFK came out last week and said that the research showed that last year, if you got the flu shot, you were 135% more likely to get the flu than if you didn't. I mean, that's a different level of failure that I don't even know how you explain. How can the product that's designed to prevent you from getting the flu actually make you more likely to get the flu? That's not a wrong strain, folks. That's absurd. I mean, I don't even know where to begin. Again, I totally agree with trust the science. I just think people that say that aren't actually trusting the science. So when we look at the numbers in 2024, the United States population, 340 million roughly, 43 million cases of the flu, about 24,000 deaths in the United States from the flu. And that means there's a 12.6% chance that you're going to get the flu. And there's a 0.0071% risk that you're going to die from the flu. So that means 1,792 people, 1 out of 1,792 people get the flu, die from it. So it's an extremely small number. So really, if you look at the stats from the CDC, year to year, it does vary some, but overall, it basically says there's little to no effect to prevent the flu by the flu shot. However, it's the best known defense against the flu, so everybody should get it. I mean, the level of logic and science based on this flu shot, it makes no sense. If you really, I Googled this just last week. I just Googled, is thimerosal still in the flu vaccine? Because they were supposed to be getting rid of that, taking it out, but I don't know what the timeline was. I really never saw any clear-cut definitive line when that had to be outside of the flu vaccine. And the answer, and check this out, it says that children were recommended to not get thimerosal back 20 years ago. However, children are still recommended to get the flu shot, and some flu shots still have thimerosal. I don't even know what to say to that. Like, it's embarrassing. Let's look at side effects of the flu shot. So all vaccines, they suppress your immune system because there's toxins in them. Mercury is one of them in the form of thimerosal. It's a well-known neurotoxin. It's in vaccines. It drops your immune system. The most common severe side effect is Guillain-Barré syndrome, which can cause paralysis. You know, about a decade ago, we had a Miss America that was deaf. That was caused by a vaccine she received. Guillain-Barré syndrome is a very strong possibility when you're getting a vaccine. Can cause paralysis, difficulty breathing, swelling around the eyes or lips. You can get hives, racing heart rate, and dizziness. Wheezing, headache, vomiting, muscle aches, runny nose, basically the flu. And then you shouldn't get a flu shot when you have a fever. You're not supposed to get any vaccine when you're sick. And a lot of doctors don't follow that either, even though that is also recommended by the AMA. Now, I can tell you, go back 25 years ago, I had doctors telling me, well, they took thimerosal out of the vaccines. There is no thimerosal in the vaccines. They took the mercury out. Right here's the box. Thimerosal, less than 25 micrograms of mercury as preservative. Understand that thimerosal is not even there to have anything to do with the efficacy of the vaccine. All it is a preservative that gives it a longer shelf life. And last I knew, you can go to your drugstore and ask for a preservative-free vaccine, and they will get it for you. And it's about $4 to $6 more per dose. So it's not even that expensive. So if we have all these side effects and all these deaths and all these long-term side effects from vaccines because there's a preservative in it that literally only decreases the price by $4 to $6 per dose, why is it still in there? Who can explain that to me that makes any sense whatsoever? You know, here again, mercury, thimerosal, formaldehyde. You know, and then we look here, we've never actually studied how the flu shot affects pregnant women, if it causes cancer, or if it causes birth defects. Again, why is this allowed? Right here, underlined, is also not known whether fluvarin can cause fetal harm when administered to pregnant women or can affect reproduction capacity. So we don't know if it could sterilize you. We don't know if it could hurt your baby, but everybody should get it. All pregnant women should get it. This is the most ridiculous thing we're dealing with right now. So why do we use this system when it's completely broken, it's extremely expensive, and it does not keep us healthy? What are we doing? We're failing miserably. So what does work? What do we know scientifically that does work? We know the vitamin D, 5,000 units a day, which is 150, I think that's a typo. I think it's 125 micrograms. I think that's a typo on that slide, but I'm almost positive 125 micrograms, 5,000 IU of vitamin D. That was shown to drop the flu risk by over 50%. A 90 count of vitamin D, you're looking at about 25, 30 bucks, and you just cut your risk of getting the flu by half. Vitamin D is shown to be 800% more effective than vaccines at preventing influenza in children. That's a no-brainer. What's the side effects of taking vitamin D? Almost nothing. I've never heard of a single overdose of vitamin D in my life. I did read a study that they gave patients 100,000 units a day for 6 months and saw no ill effects. I would not recommend taking that. That's insane amounts, but that just shows you how safe it is and how much you can actually take with not seeing a problem. So what kind of antivirals are there out there? We don't even hardly hear about these anymore, but like Tamiflu, when it came out, it wasn't top news. You didn't hear this huge rush for it, but Tamiflu comes out, and then they did this study on it from the Cochrane Group that showed that it reduced your risk of getting or your days of symptoms. Like if you got the flu, if you didn't take anything, you'd be better in 7 days. If you took Tamiflu, you would be better in 6.3 days. They weren't sure on the results in children. There was no reduction in the severe symptoms like pneumonia, increased your risk of nausea, increased risk of psychiatric events, and the United States government was so excited at these amazing results that we dropped $1.3 billion to stockpile Tamiflu. Come to your own conclusion. Side effects of Tamiflu: nausea, vomiting, diarrhea, bronchitis, abdominal pain, dizziness, headache, cough, insomnia, vertigo, and fatigue. Autoimmune disease. This is a rampant topic that I don't even know if anybody has a clue how many autoimmune diseases diagnosed there are right now. It seems like there's literally hundreds of ones added every single year. It's out of control, off the charts. So, autoimmune diseases are a huge factor. Now, what an autoimmune disease is for some reason your immune system is freaking out and it's attacking you, right? Your own immune system is attacking your own tissue. Why would it do that? Obviously, there's a disconnect there, and it's very confused, and something's wrong. Now, when you look at modern medicine, they would say, oh my gosh, your immune system's attacking you. We should suppress it. We should attack our immune system and weaken it. Every study I've seen, every patient I've treated actually responds better when we take an autoimmune disease and amp up the immune system. Now, I can understand why people would disagree with that, because if it's already attacking you and you amp it up, that's going to give it more power to attack you. But the reality, from what I see in the studies, is the weaker your immune system is, the more likely it starts attacking you. It gets confused, it's weak, and it's attacking healthy tissue. You amp it up, and it stops doing that, and now it starts attacking infections again. So that's a huge variation between modern medicine and holistic medicine. But I've seen a lot of great results by boosting an immune system. Another thing is basically making sure your body is alkaline. And what we see is a pH above 7.2 is where we should be. And if you have a pH over 7, literally autoimmune disease does not exist. It's a huge factor. The doctor that wrote the alkaline diet, he wrote the book on it, and he got arrested and thrown in prison because he was practicing medicine without a license. In 1996, the CDC came out and said they had discovered the first superbug. Now, this was basically a bacteria that could live off of antibiotics. That terrified people, right? That's scary. You know why you don't hear about this? Because they have no answer. There is no drug that stops this. There's nothing they can do to stop it because it lives off the stuff they usually stop it with. It's called MRSA. Maybe you've heard it. So MRSA is basically caused more deaths than AIDS on an annual basis. This has been going on since 2005. So MRSA is very deadly. And Medicare, even if you read the Medicare coverage manual, I wouldn't recommend it. But anyway, it says in there that they will not cover treatment for MRSA because MRSA was caused by over usage of antibiotics by the hospitals, and thus since the hospitals caused them, the hospitals can pay for it. So that's what Medicare thinks of MRSA. Now, what MRSA is at the core, it's a staph infection. It stands for methicillin, which is an antibiotic, resistant Staphylococcus aureus. So it's very deadly. So what do you do if you get MRSA? What are you supposed to do? How do you survive a staph infection that's a superbug that can eat antibiotics? Now, if you get MRSA and you go to the hospital, they're going to put you on about 5 of the most potent antibiotics they can find in an IV drip. Typically, it will suppress it, and MRSA will come back. But the reality is, we're looking at this all wrong. Okay? It's not about treating a disease. It's not about treating a bacteria. It's not about medication. You don't get MRSA because you were deficient in an antibiotic. You've got to look at the cause, and you've got to look at the underlying condition. The reality is, healing comes from within. Our body is designed to heal itself. MRSA can be resistant to antibiotics. MRSA is not resistant to your white blood cells. So when you're trying to kill MRSA with an antibiotic, you're going to lose. If you try and kill MRSA by boosting your white blood cells, you're going to win. It's as simple as that. Going back to a quote by B.J. Palmer, our body always heals from above, down, inside out. It happens no other way. We've got to make our body healthier, and then it's going to fight these things off, right? There's no such thing as disease. There's a lack of healing. There's no such thing as autoimmune or illness. It's a lack of healing. There's something that the body is missing, and so then it's not healing itself. So when we look at an optimal cell, right? Optimally healthy cell versus a okay healthy cell versus a diseased cell, right? So when it breaks down, to have an optimally healthy cell, you need good nerve supply, good nutrition, good electromagnetics, good hydration. Those are all key to having an optimally healthy cell. Now understand that an optimally healthy cell has the exact same charge as a bacteria or a virus. Thus it has a natural force field, an electromagnetic force field, like two magnets. When you put two magnets together one way, they repel each other. And so that's exactly what an optimally healthy cell does. Now, if you get dehydrated, your nerve supply is off, you're malnourished in something specific, that can flip the polarity of the cell. And now not only does it not have that electromagnetic force field, now it's actually attracting bacteria and viruses into the cell. Now that's when we start feeling symptoms, is when our cell starts getting damaged. When we get cells start getting damaged, that's when we start feeling sick, okay? So that's when we start getting disease or illness, because we're getting damage to the cell. So overall, the most important thing to optimal health and healing is making sure that your brain is communicating to every one of our 72 trillion cells all the time. So to have peak performance, as you see on this chart on the bottom left, you got to have peak body chemistry, right? Our physiology has to be healthy. How does it stay healthy? Well, the brain's got to be able to communicate to your organs, right? So the brain's sending a signal down the spinal cord, out the nerve roots to every cell in the body. Those bones that it's coming out of, that's your spine, right? We get subluxation, which is the pressure of a bone putting pressure on a nerve, blocking the message from the brain to that part of the body. The research shows it takes less than the weight of a dime of pressure to shut a nerve down by 60%. It's Dr. Chung Ha Su's research from the University of Colorado. Very sensitive. So that interferes with our nervous system communication network, imbalances our body chemistry. Now we have lower performance, right? That's how we get disease. That's how we get sick. That's how we start getting chronic problems. So to correct the spinal alignment, to correct posture, this is not just chiropractic, but as far as more like biophysics. Chiropractic biophysics specifically focuses on postural correction. If I adjust you once, I am not fixing posture. You might feel good for like 2 to 3 hours, but it doesn't do any long-term changes. Again, going back to the medical profession, over and over and over, I have MDs telling my patients, oh gosh, don't go see a chiropractor. They could cause a stroke. You know, you're actually 10 times more likely to get hit by lightning than to have a stroke from an adjustment. You're actually more likely to die from taking an aspirin. 3,000 people die every year from taking an aspirin than getting an adjustment. I've performed over 50,000 adjustments in my career. I don't even know. It's not even close. I've had over 10,000 patients. Hundreds of thousands of adjustments by my hands in my life, and only one time have I ever had an ambulance at my office, and that's because the ambulance driver drove here to get adjusted. But when we do corrective adjustments over time, it's so much more powerful than just an adjustment. That restores the communication between the brain and the cell. My phrase that I feel is that it's connecting your soul to your cell. That's the power, right? Your soul is the power. So getting the communication of the soul to the cell is the key to health. It rebalances our body's chemistry and it restores peak performance. So again, when you're having something wrong, why don't we get the nervous system checked? Why shouldn't everybody get their nervous system checked? It's absolutely insane not to. Power of the major body is always what heals your body. It's absolutely true. This is a quote from Dr. Ron Peru. He was actually an oncologist, and so what he did, he took 3 groups of patients. He took a group of cancer patients, and then he took a group of what he said was average. Now, his version of average was they didn't have a diagnosis of any type. I believe it was for 6 years. That's, to me, a little better than average. And then he took a group of chiropractic patients that had been long-term chiropractic patients, like over 15 years of chiropractic care. Took those 3 groups, and then he tested tons of enzymes that relate to the potency of the immune system. It's a phenomenal, very detailed research study that was done by Dr. Perot. And the conclusion was he found that the cancer patients had a 200% weaker immune system than the average patients. And that the average patients had a 200% weaker immune system than the chiropractic patients. So a 400% difference from the chiropractic patients to the cancer patients. Incredible, incredible difference. So to stay healthy, we've got to keep our immune system healthy, right? Have a proper diet, good nervous system communication. Stress is what kills us, right? Stress creates a huge problem. So we got to be more adaptable to our stress. So we want to exercise, eat more fruits and vegetables to keep us alkaline. Drink water. You want half your weight in ounces of water a day. That leaves your body able, agile, and alkaline. So then to prevent nervous system overload, maintain 100% nerve supply, get adjusted regularly, corrective adjustments. Make sure, the best way to find a good chiropractor that I would recommend, find one that is going to x-ray, check posture, adjust a series, x-ray again, and check again. Because without that, how do you know what you're changing in posture? I hear chiropractors all the time say, well, I can just feel it. I don't need to x-ray. I've actually x-rayed 6 different cases that came into my office, wanted adjusted, were adjusted by another chiropractor in my town. 6 cases that had a broken back that were adjusted, and then we caught it because we x-rayed. You can't feel that, right? There's a lot I can feel. I'll agree. Chiropractors can feel a lot. But there's things you can't feel. And I would rather know and be safe than guess with your health. So I highly recommend somebody who's going to x-ray to just rule out a lot of things that could be going on that we just don't know. So consistent postural corrective adjustments keeps your body aligned and adaptable. So I want to thank you for your time. It's been so great talking to you today. Got to reference CJ Mertz on some of these slides. He does a great job. Great friend of mine. Just appreciate him and everything he's done for our profession and for our planet. And I just I pray that this reached out to some of you out there, and that it helped get you some insight to how to get healthier and stay healthy for life. Till next time, Dr. Chris signing off. Thanks.